Alright, so today I will be demonstrating a midline dressing change. First step is to verify the healthcare provider's orders. So I went ahead and did that already. And then I will introduce myself to the patient. So, hello sir, my name is Joe. I'll be your nurse taking care of you this evening.
Hello.
And then, I almost touched my face. And then you will provide privacy for the patient. And so you would either shut the door or draw the curtain. And then we perform hand hygiene, so I would wash my hands or foam in or gel out, whatever. And then two patient identifiers. So, sir, could I have your name and date of birth?
Justin Welch, August 8th, 1996.
Okay, do you have any allergies?
No, sir.
Okay. And so what we're going to be doing today, we're going to be changing this out and cleaning the site.
Okay.
And after that, I will put on gloves. So for this procedure, everyone in the room gets a mask just to keep everything as sterile as possible. So I will put my mask on and then the patient will put his mask on. Put this on. Okay. So we have already placed the pad underneath the patient's arm just to keep everything as clean as possible, and if anything is to drop or spill or anything, it's going to be on the pad. Next step, we will open the dressing change kit. And so when doing this, try not to reach over the kit because that counts as breaking sterile field. So now I'll put on my sterile gloves. Hand hygiene again before putting these on. So, a few steps I forgot. Before putting on your sterile gloves and while you have the other gloves on, we need to get rid of this dressing. So I will do that now. And the proper way to get rid of this dressing is you want to peel in all of the corners first. And then, so taking this off, you'll leave all that exposed. And so from there, the next step would be to put on your sterile gloves. And so after you've put on your sterile gloves, you're going to clean the site. What you use is this chlorhexidine. So I actually have to clean it. You crack it, and that kind of releases the alcohol in it. And so you will move in a linear motion, like front to back or side to side, for 30 seconds. Is it cold?
No.
And so once you've done that for 30 seconds, then you will go in a circular motion heading out, and you will need to clean all of the area that was under the dressing. So you go. And then you would just dispose of that. Oh, I guess that's to clean it. And so this will simulate the biopatch. In a real world setting, you'll have a biopatch. And what that is, it's a circular little, like a cotton ball, but flatter. And one side has like alcohol and everything, and that's the side that you would place on the insertion site. And so this is gonna go like that. And then once the biopatch is on there, now you place the transparent dressing on them. And so once that is done, the nurse will need to initial it and date it. And then that is all for that. After that, you would ask the patient if they need assistance or anything. So, Mr. Welch, are you in a good, comfortable position?
Yes, sir.
Can I help you with anything before I leave the room?
No, sir.
Okay. So here's your call. And then you will take off the gloves, and then you will clean up your mess. And then you take off your mask before you leave the room. And then the patient will take off their mask. All right, then you perform hand hygiene, and you just make sure the patient's bed is locked and lowered, 2 side rails up, and that is it.